which there may be no linguistic equivalent in the target language. This is especially true in the medical setting, where references are constantly made to body parts, illnesses, foods, and family relationships, which cannot be easily interpreted. Moreover, there may be healthcare terms that as concepts simply do not exist in the target language. Next, we will give you a few ideas to solve such challenging situations. Paint a word picture. Provide a brief description of what the term means in order to convey the meaning, in spite of the lack of an exact equivalent. An explanation will provide the necessary information for the communication to continue between both parties. If there is a healthcare term with no linguistic equivalent in the LEP patient's language, alert the provider and let the healthcare provider a different way. Then you may proceed to interpret the provider's explanation. Example: healthcare provider. Do you have a living will? Interpreter. Excuse the interpreter, but there is no equivalent term for living will in XYZ language. Could you please explain what is a living will? Healthcare provider. It is a written document a person uses to make known his or her wishes regarding life-prolonging medical treatments. It can also be referred to as an advance directive. The person states that in case of irreversible brain damage or terminal illness, whether he or she wants or not his or her life supported artificially. Interpreter. Thank you. Addressing the LEP patient in language proceeds to interpret the provided explanation. According to our guidelines, information needs to be obtained in appropriate segments so you can provide a complete and accurate rendition. The length of the segment obtained may depend on your level of retention or your note-taking skills. When the healthcare provider or the LEP patient has given a sufficient amount of information for you to interpret, yet continue to talk, you should in a courteous and professional manner request that information be given in workable segments prior to proceeding with your rendition. When you are interpreting on site, you can use hand signals to aid yourself in eliciting pauses from the speakers, but in the over-the-phone setting, you need to verbalize your request for cooperation. Usually, after you request shorter segments once, both parties on the line cooperate with you. Example: healthcare provider. Clean the belly button area with alcohol every time you change your baby's diapers, using a cotton ball or alcohol wipes. Do not immerse your baby in water until the belly button has completely fallen off. For the time being, give them sponge baths, drying them right away. Also, make sure to the interpreter interrupted and said, "Excuse me." Interpreter. Excuse me, this is the interpreter speaking. I'm sorry for the interruption. To ensure accuracy, the information provided in shorter segments will be greatly appreciated. The interpreter will interpret now, in language to the LEP patient. Clean the At times, the level of complexity of a language can present problems between speakers, even when they both speak the same language. Healthcare practitioners who have spent years of their lives studying to practice medicine are often accustomed to talking about illnesses and treatments by using complex language that patients may not readily understand. In addition to the different languages of our speakers, we also must be aware of differences in language complexities or register. Register refers to the level of formality or complexity of the language a person chooses to use. High register speech is very formal and complex and can be readily found in any professional setting. Register can be a complex issue, and there are several ways of dealing with different in the medical setting. This should not be a concern for the types of medical faults fully interpreted. If, however, you encounter a situation where the provider is using complex language and you suspect the LP patient may not understand, you may alert the healthcare provider and then follow his or her lead. Example: healthcare provider. Your son has type 1 diabetes, which is classified as an autoimmune disease. In other words, a condition in which the body's immune system attacks one of the body tissues or organs. There with high and low blood glucose levels and treatment options. Interpreter. Interprets in target language. LEP parent. Excuse me, but I do not understand a word of what you are saying. Interpreter. Excuse me, but I do not understand a word of what you are saying. Healthcare provider. I'm confused. I was writing on my notes. Who did not understand? Interpreter or mom? Interpreter. This is the interpreter speaking. The mom did not understand. Sir, perhaps if you could explain to her the same information using simpler terms, she may be able to follow you. Never take it upon yourself to change the register. Alert the provider of any perceived miscommunication and follow the provider's lead. In general, it is important to keep interventions short and unobtrusive in order to obtain the integrity of the communication between the healthcare provider and the LEP patient. Nevertheless, there may be times where you will need to intervene to ensure that understanding is taking place between both speakers and to allow both parties to successfully communicate. When do you intervene? Whenever either party uses a term that needs an explanation or needs to be placed in a cultural context to be understood. Whenever someone uses a language you do not understand. When you suspect the LEP patient may not understand what is being said. When you need a repetition to ensure accuracy in your rendition. When you need to obtain workable segments from either party in order to interpret accurately and completely. Following are some guidelines for effectively intervening during a medical interaction. Stay calm and professional. Don't make assumptions. When in doubt, request permission to clarify. Make sure your intervention is transparent to the client and the LEP patient, and making sure the provider and the patient both know you are intervening to request a clarification. It will avoid a lot of confusion. Remember to switch to the third person when referring to yourself as the interpreter when requesting a repetition or a clarification. This way, it is clear to both. Example: Doctor, the interpreter requests a repetition of the last part, please. Once you're finished with your intervention, resume interpreting as quickly as possible, switching back to first person as you are back to your role of conduct.
Navigation instructions. This lesson contains audio throughout its entirety and will run automatically. You may use the buttons below if needed. Play pause button, back button.
L3 Non-Clinical Medical Pulse, Part B. Healthcare insurance in the U.S. The United States provides government-run healthcare services in veterans hospitals and mental hospitals, and it also has 2 governmental health insurance programs. One of the healthcare programs is Medicaid, under the Social Security Act of 1965, for the elderly or retirees. Medicare is an insurance program that primarily covers senior citizens ages 65 and older, and disabled individuals who qualify for Social Security. The second program is Medicaid, It is a healthcare program that provides health coverage to low-income families and individuals, including children, parents, pregnant women, and people with disabilities. Medicaid is funded by the federal government jointly with each state, whereas Medicare is a federally funded healthcare program. The Center for Medicaid and Medicare Services is a federal agency that oversees both programs. Medicare. Eligibility requirements. Anyone 65 or older can enroll into Medicare so long as they pay into Medicare/Social Security funds, regardless of income. People of any age with severe disabilities and end-stage renal disease are also eligible. Services covered. Different parts of Medicare cover different services. Part A coverage for hospital insurance. Part B coverage for medical, exams, procedures, insurance, and eligible home health services. Part C or Advantage plans coverage for additional benefits such as vision, dental, and hearing. Part D coverage for prescription drugs. Cost to enrollees. There is no cost for Part A for those who paid Medicare taxes for 10 years or more, or had a spouse who did. Part B, C, and D vary in costs. Medicaid. Eligibility requirements. Strict income requirements related to federal poverty level, FPL. Some states that opted out of Obamacare have a variety of income requirements. Services covered. Children are more likely to have comprehensive health coverage in all states than adults. Routine medical and emergency care, family planning, hospice, some substance and smoking cessation programs. Limited dental and vision. Cost to enrollees. Varies by state, with some imposing deductibles, usually low, but much may depend on what little income that person has. Privately sponsored individual or group health insurance. There are different types of coverage offered. Some are under the HMO, Health Maintenance Organization Service type, or PPO, Preferred Provider Organization type. Premiums are paid by individuals or by groups, mostly through employer-sponsored programs. However, in the United States, the majority of health insurance is operated on a privately sponsored individual or group basis. Language line solutions interpreters need to be aware of all elements that conform in the U.S. healthcare system that may be very confusing for the LEP patients. For example, LEP patients often do not understand why they can't go to any doctor they want, why they can't make an appointment directly with a specialist, where they can go to see a doctor if they don't have any money, why they still have to pay a copayment to see the doctor if they have insurance, why they have to pay a deductible if they have insurance, why the insurance company makes them pay a portion of the bill though they already paid their visit copay and monthly premium. Next, we will review some healthcare insurance terminology to ensure you understand the concepts to better assist our client and their LEP patients. Relevant terminology. Annual deductible. The amount of covered expenses an insured person must pay in a plan year before the insurance plan pays any benefits. Coinsurance. After a member has paid any plan's deductible, he/she may still be responsible for a percentage of the billed charges for services received. This charge is called coinsurance. For instance, if the health plan pays 70% of billed charges, the member's coinsurance payment is the remaining 30%. Copayment/copayment refers to the flat amount a member pays to a healthcare provider or pharmacy at the time of service. Copayments vary depending on the plan and services received. Deductible. See annual deductible. In-network refers to providers who have contracts with a health plan to provide services at a set rate. Relevant terminology. Monthly premiums refers to the monthly payment members make to an insurance company or a healthcare plan for healthcare coverage. Out-of-network/non-network provider refers to any healthcare professional or suppliers who do not belong to a health plan's provider/pharmacy network. Primary care physician refers to the doctor an HMO member sees first for most health problems. Please make sure that you get the care you need to stay healthy. In many HMO plans, members must see their primary care physician before seeing any other healthcare provider. Referral refers to a written approval from the member's primary care physician so that the member can see a specialist or to receive certain services. Specialist, a doctor who treats only certain parts of the body, certain health problems, or certain age groups is a specialist. Individual versus group plan. When an individual wants to get healthcare insurance coverage, most insurance companies will require physical examinations, full disclosure of previous medical history, and disclosure of hobbies, work duties, financial status, and much more before providing healthcare coverage. After reviewing all the information received from the individual, the insurer will then issue the policy, sometimes with exclusions for certain conditions, or simply refuse to issue the healthcare policy. Healthcare insurance provided to employees by an employer or by an association to its members is called group coverage. Health insurance people by their own, not through an employer or association, is called individual coverage. Types of HC plan. Common healthcare insurance plans. Each insurance company or brand may offer one or more of these four common types of plans. Health maintenance organizations, HMOs. Preferred provider organizations, PPOs. Exclusive provider organizations, EPOs. Point of service, POS plans. Health maintenance organizations, HMOs. In most HMO plans, members get healthcare and services from doctors, other healthcare providers, or hospitals in the plan's network. Those are referred to as in-network providers. These providers have agreed to accept payment at a certain level for their services, which allows the HMO to keep costs in check for its members. Because of this agreed upon payment, an HMO usually offers lower monthly premiums than other insurance plans. HMOs tend to have lower copays and coinsurance, which helps make them more affordable. However, even though costs are generally lower with an HMO, they don't cover any out-of-network care except in a true emergency. With an HMO, members must choose a primary care physician, PCP. This doctor will see the member as often as needed. If the member were in need to see a specialist, the member would first see the PCP. Then the PCP would provide a referral to see a specialist within the HMO's network. Usually, the specialist is within their network, thus those services will be covered by the member's insurance after making any copays or coinsurance and meeting their annual deductible. Preferred provider organizations, PPOs. PPO refers to a medical care arrangement in which medical professionals and facilities provide services to subscribed clients at reduced rates. PPO medical and healthcare providers are called preferred providers. PPO plans provide more flexibility when picking a doctor or hospital. They also feature a network of providers, but there are fewer restrictions on seeing non-network providers. In addition, your PPO insurance will pay if the member sees a non-network provider, although it may be at a lower rate. Some key features include: members can see the doctor or specialist they'd like without having to see a PCP first. They can see a provider or go to a hospital outside the network and be covered. However, their benefits will be better if the member stays in the PPO network. Premiums tend to be higher, and it's common to have a deductible to meet. Exclusive Provider Organizations, EPOs, refers to a network of individuals or groups of medical care providers who have entered into a written agreement with an insurer to provide health insurance to subscribers. This health insurance plan requires members to use the doctors and hospitals within its own network, like a health maintenance organization, HMO. EPO members cannot go outside of their plan's network for care. There are no out-of-network benefits under an EPO health insurance plan. This type of insurance plan does not cover if the member sees any provider outside the EPO network. But because of such limitations, EPO plans generally can work well for individuals who don't anticipate needing a great deal of medical care and want to save money. The EPO health insurance plan offers the flexibility to members to visit specialists within their own network without needing a referral, which makes the process a lot faster if the member knows what he/she needs and doesn't want to go through a primary care provider to get it. Point of service plans, POS, refers to a type of managed care plan that is a hybrid of HMO and PPO plan. It's a type of managed care health insurance plan that provides different benefits depending on whether the policyholder uses or out-of-network healthcare providers. A POS combines the features of the two most common types of health insurance: the health maintenance organization, HMO, and the preferred provider organization, PPO. POS plans only represent a small share of the health insurance market. Most policyholders have either HMO or PPO plan. Employer-sponsored plan. Under an employer-sponsored health insurance plan, the employer pays a portion of the premium and the employee pays another portion. If an individual insured through his/her employer loses his/her job, that individual can choose to continue health insurance coverage under the COBRA provisions for up to 18 months. COBRA stands for the Consolidated Omnibus Budget Reconciliation Act of 1985, federal legislation that allows an insured worker to continue paying for health insurance for up to 18 months if they lose their job or the employer-sponsored coverage if otherwise terminated. COBRA. The advantage to continue having healthcare coverage under COBRA provisions is that even though the employee will pay for the policy premium entirely, the premium will be lower than an individual insurance premium. What this means to the employee is that once the group policy stops covering him/her after the termination of employment, the employee may continue his/her medical coverage with COBRA, which is basically an extension of health insurance coverage allowed by law. Language Solutions interpreters receive many calls from members of individual and group or employee-sponsored plans. Types of healthcare insurance calls. Many healthcare insurance calls deal with inquiries about benefits. For example, an LEP who has group insurance may request information about vision coverage. This call may seem simple at first, but it may involve terminology about the types of lenses, i.e. single vision, progressive, blind, bifocal, or trifocals, and type of protective coating they want. We want to encourage you to learn the terms in the glossary related to the type of calls you will start receiving. Types of healthcare insurance calls. Other calls may involve inquiries about bills received after a visit to the emergency room. Many LEP callers do not understand why they are receiving up to 3 bills after they were in an emergency visit, though they have healthcare insurance. Other calls deal with LEP persons filling in health insurance application forms. Others are for parents of babies born in the U.S. who need to complete a form. Some calls are from pregnant LEP moms who need assistance during their pregnancy and are looking for doctors to assist them during their delivery. Next, we will provide you with an overview of workers' compensation insurance. Types of healthcare insurance calls. Many calls are related to obtaining a prescription to refill a medication, or the call is about the prescription coverage the caller may have. During the Medicare open enrollment period, we get many calls about type of plans, type of coverage, about premiums, and optional coverage Medicare plan members may get. Likewise, we get calls from different Medicaid, state-managed, and sponsored plans. Many Medicaid recipients want to understand their coverage or have questions about options they may qualify for. We must remember that Medicaid programs are different in every state. We receive Medicaid calls from states like Florida, Georgia, Texas, Oregon, etc. Resources. To get acquainted with these programs, it is advisable to visit www.cms.hhs.gov/home/Medicaid and also www.floridamedicaid.com, www.oregon.gov/dhs/healthclinic, www.hhs.state.tx.us/Medicaid, www.ghb.georgia.gov. What is considered durable medical equipment? These are therapeutic devices primarily and customarily used to serve a medical purpose/therapeutic need, are not useful to a person in the absence of illness or injury, are ordered or prescribed by a physician. They are reusable and stand for repeated use and are appropriate for use in the home. Commonly they include wheelchairs, manual and electric, traction equipment, canes, crutches, walkers, lifts, kidney machines, ventilators, oxygen monitors, pressure mattresses, nebulizers. Insurance companies will provide coverage for durable medical equipment when it is determined to be medically necessary, meaning the medical criteria and guidelines for its use are met. During the Medicare enrollment period, we get many new Medicare recipients who call about coverage. Durable medical equipment may be covered when all of the following criteria are met. 1. The equipment provides therapeutic benefit to a patient in need because of certain medical conditions and/or illnesses. And 2. The DME is prescribed by a licensed provider. And 3. The DME does not serve primarily as a comfort or convenience item, and 4. The equipment does not have significant non-medical uses, e.g. environmental control equipment, air conditioners, air filters, and humidifiers. Interpreters need to become familiar with some durable medical equipment names and purposes. Interpreters are encouraged to look into the libraries for glossaries to assist them with these calls. Braces, lift recliners, nebulizer, scooters. Workers' compensation insurance. Workers' compensation is a form of insurance providing wage replacement and medical benefits to employees injured in the course of employment. It was designed to ensure employees who are injured or disabled on the job are not required to cover medical bills related to their on-the-job injury. These laws provide employees with monetary awards to cover loss of wages directly related to the accident, as well as to compensate for permanent physical impairments. It is a no-fault system, meaning that injured employees do not need to prove the injury was someone else's fault in order to receive workers' compensation benefits for an on-the-job injury. Covered losses are bodily injury from accidental means, including death, occupational diseases or physical conditions unique to the occupation, for example, black lung disease for coal miners, cancer to asbestos workers, carpal tunnel syndrome caused by repetitive action of the hand and arm, etc. There are 5 basic types of benefits provided under workers' compensation. Medical benefits that include all necessary treatment and supply of artificial limbs. Rehabilitation benefits that may include therapy, vocational training, cost of transportation, medical devices such as wheelchairs and others, as well as lodging and living expenses while traveling for rehabilitation. Death benefits that help the family pay for funeral expenses in case the injury results in death. Compensation for pain and suffering. This is an additional amount of money that is given to the injured worker to compensate for the suffering caused by the illness or injury, and it is usually determined by a labor law judge or arbitrator. Income replacement benefits. Income benefits are paid in most cases since on-the-job injuries usually cause a partial or temporary disability that will prevent the injured worker from performing job duties for which he would be paid a salary. Because workers' compensation benefits and payments are not taxable, an injured worker will usually be paid a percentage of his or her gross salary. This way, the worker would not be taking home more money while injured than when he or she is at work and taxes are being deducted from the paycheck. The most common percentages paid, and these vary depending on jurisdiction, are somewhere between 66 and 2/3% and 75% of the gross average salary of the injured. Income replacement benefits can be paid for as long as 500 weeks for permanent disability and can continue to be paid to beneficiaries for that period of time if the injured worker dies before the end of the benefit period. However, most states have capped the maximum weekly benefit at around $1,000 per week, regardless of the employee's average weekly wage, AWW. The benefits for partial disability are calculated in a different way. Since an employee on partial disability is assumed to be able to work at least part-time or in a light-duty job, partial disability benefits are calculated by reducing the employee's AWW by his/her current earnings or earning capacity. Nurse case managers serve as a liaison between all parties involved in workers' compensation, including doctors, the injured worker, the employer, and the insurance company. A nurse case manager is responsible for helping an injured worker to obtain the medical care that he or she needs. This nurse is in charge of following the progress of the rehabilitation process of an injured worker by talking to the injured worker, doctors, rehab facilities, etc., and making sure that all is being done to return the worker to the job as soon as possible. Nurse case managers work for the insurance company, and their goal is to make sure that there are no delays in treatment, because the sooner the worker returns to the job, the sooner the insurance company will stop paying benefits. Recovery is the amount of money or reimbursement for medical treatment that an injured worker will receive for injuries at work in the course of employment. Because of the no-fault system, recovery is limited. Since employees cannot file a lawsuit, they cannot get punitive damages. However, workers' compensation benefits can be substantial depending on the state the injured worker lives in. Washington, for example, is very generous to injured workers, whereas Texas and California are not as generous with workers' compensation benefits. Case Manager Questionnaire. After a worker suffers an accident at work, usually within 24 to 48 hours, a nurse case manager will call the injured worker and get a recorded statement. The case manager wants to ensure the worker has been properly diagnosed, that she/he is following treatment, and how soon the worker can get back to work. Some common questions may include: how did the accident happen? Did the injured worker receive immediate assistance? What further treatment or diagnostic studies have been recommended? Has the patient reached permanent and stationary status? If yes, on what date?
Bueno chicos, entonces practiquemos. Vamos a repasar rápidamente las para la práctica. Entonces, hoy vamos a practicar también toma de notas de forma temática. Recuerden que información que venga en forma de identidades propios debe quedar anotada. Vamos a dejar números y propios en nuestra dejarlos anotados para completar la información de manera conjunta. Dentro de los segmentos también siempre va a haber información fáctica. Entonces, de esa información fáctica vamos a los verbos y los sustantivos en nuestras notas. Vamos a asegurarnos de anotar todos los verbos y todos los sustantivos, es decir, todas las acciones y todas las cosas que se mencionen en el mensaje. Vamos a anotar que esos verbos y esos sustantivos de manera abreviada, es decir, de manera más corta. Vamos a anotar palabras completas para no gastar tanto tiempo. Les digo rápidamente las tres técnicas principales para abreviar. La primera es anotar solamente las primeras 3 o 4 letras de la palabra. La segunda es anotar solamente las consonantes, no anotar las vocales, anotar solamente las consonantes. Y la tercera técnica para abreviar es designar la inicial de la palabra para la palabra. Ayer les comentaba del verbo unir, que es muy común tanto como verbo principal como verbo modal, es decir, ni, verbo. Eso es muy común. Entonces, para asegurarnos de anotar el verbo unir, utilizamos la variabilidad N. Y así, de la misma manera, podemos hacer con otras palabras. Podemos designar la inicial de la palabra para anotar la palabra, para hacer la nota de la palabra de manera abreviada. Por ejemplo, la letra H para la palabra hospital. Es importante que designemos esa inicial solamente para una palabra y no para más, para evitar confusión. Entonces vamos a anotar verbos y sustantivos de manera abreviada. espacio en blanco y lo señala con un círculo o con una línea o la que ustedes quieran para que sepan que en esa parte del mensaje falta información. Me olvida la repetición por el número 2. Yo leo el mensaje de nuevo y ustedes completan el mensaje con la información que les di y luego interpretan de manera correcta y completa. También vamos a utilizar el diccionario, entonces tengan listos
If
los
not,
diccionarios
let's rewrite this
por reference
meaning dictionary status. Can this
y
patient
vamos a tomar notas en inglés. Los mensajes de hoy pues, son en inglés, entonces vamos a tomar nota de ellos en inglés también. Eso es lo que vamos a hacer. Entonces, listos los funcionarios, listos para las notas. Okay. Yes, aquí. Your daughter, Christian Dr. Norris. The pediatrician will then refer you to a neurologist who will evaluate your condition further and give you a diagnosis. Diana? The appointment for your daughter will be with her pediatrician, Dr. Norris. The pediatrician will then refer you to a neurologist who will evaluate her condition further and give you a diagnosis.
The appointment of your daughter will be with her pediatrician, Dr. Norris, and the pediatrician will refer her to the neurologist who will refer her to no, sorry, I will repeat that. Doctor, and will evaluate for the research
Okay, that's a faithful repetition of the message. That's okay, but we are going to interpret. So could you please render the message in Spanish?
Okay. La cita de su hija será con su pediatra. Persona. Y va a evaluar la condición de su
Okay. El término further, tal vez tengas algo parecido a daughter, por eso dijiste de su hija.
Sí.
Pero tiene letras en por eso creo que eso fue lo que pasó. La D, la H, la N, la E, etc. El término era further. Ya. Asegúrate de tomar de manera más clara, o sea, con las letras que tomes, tomarlas más claramente para que te pase esta situación. ¿Cómo se interpretaría un cuidado de fallo de interpretation further?
Diagnosticar.
Evaluar también. Puedes utilizar la interpretación literal, sí. Entonces, who will evaluate her condition further? Sí, más a fondo. cancela como pediatrician. Pediatrician. Sí, pediatrician. Sigamos con el siguiente. The total balance of your retirement account is $13,678.29 as of the close of market yesterday, June 22nd. You also have an outstanding loan for $2,889, which is scheduled to be paid off in August. Lisa? The total for your retirement account is $13,678.29 as of the close of market yesterday, June 22nd. You also have an outstanding loan for $2,889, which is scheduled to be paid off in August.
Total balance of your retirement account is $13,678.29 as of the close of market yesterday, June 20th. You also have an outstanding loan for $808 that is scheduled for paid in August.
Está bien, Luis, por ese lado muy bien. Pero vamos a interpretar. Creo que mi instrucción no fue clara al principio y me disculpo por eso. La instrucción es que los mensajes los vamos a interpretar. Es decir, todos los mensajes que yo les voy a leer van a estar en inglés y ustedes nos van a interpretar en español. Van a tomar nota en inglés, pero lo van a interpretar en español. ¿Puedes interpretarlo, por favor, Luisa?
Sí. El saldo total de su cuenta de jubilación es de $378 con al cierre del mercado ayer.
Oiga, fuera, ¿usted qué se entiende? Fuera, pues.
Está previsto a ser pagado
Bien. Solamente falló en los centavos de la primera cantidad. Y este 19 centavos tendrá 20. Pero cuando lo realizas en inglés y lo exterior, ahí eso sucedió. Bueno. The welfare office is located at 3113 Huntington Avenue, right on the corner with Williams Street. Just go to the reception desk, give them your social security number, and they will tell you who your social worker is. Maria? The welfare office is located at 313 W. Arlington Avenue, right on the corner with Williams Street. Just go to the reception desk, give them your social security number, and they will tell you who your social worker is.
La oficina de bienestar estaba ubicada en la 3 justo en la esquina con
Un cliente más.
solamente diríjase a la recepción y debes seguridad social y ellos te van a decir quién será su trabajador social.
Perfecto, María. Chicos, aprovechen todos los segmentos para practicar, por favor. Si más o menos un hombre, otra persona no está interpretando de todas maneras, del mensaje, pónganle atención, dísenlo y si quieren interpreten para ustedes mismos por el movimiento. De esa manera pueden aprovechar estos segmentos para practicar y así prepararse para pasar la ISE. Bueno, vamos con el siguiente. Catherine, Roberto, and Patricia all need to have their immunization records updated since they were out of the country for more than 6 months. Please take them to the Riverside Clinic on Thursday at 2 p.m. Catalina.
Fuera pues.
Patricia, all need to have their immunization records updated since they were out of the country for more than 6 months. Please take them to the Riverside Clinic on Thursday at 2 p.m.
Catherine, Roberto y Patricia, todos necesitan tener su reporte de inmunización actualizado porque estuvieron fuera del país por más de 6 meses. Por favor, llevarlos a la clínica Riverside el jueves a las 2 de la tarde.
Sin embargo, dejaste immunization record o interpretaste como récord de inmunización. Sabemos que en español
Registro de vacunación.
ese tipo de palabras más del inglés se usan como ven. Pero en nuestras interpretaciones debemos poner todas las posibles en español. ¿Cómo diríamos immunization records en español?
Archivo.
Archivo más como file.
Registro de vacunación.
O carnet de vacunación.
Carnet es un garantía, o sea, viene del francés, mejor no lo utilizamos. Pero puede ser una interpretación. Lo importante es que ese tipo de palabras que solemos utilizar en inglés, solemos utilizar en inglés en español, no las utilizamos en interpretación. Palabras como spray, que en español decimos spray. Eso no sería correcto, es decir, atomizado. Lo mismo que dejarla en inglés, sí, interpretarla como registro. Gracias. ¿Por qué no preguntas, Juan? Porque una interpretación profesional incluye todas las palabras que en el idioma que se está interpretando. Hay algunas poquitas excepciones en las que no hay una palabra en español y se acepta toda la palabra en inglés. Por ejemplo, STEM. No hay una palabra en español para STEM. Entonces es válido decir STEM. Pero son muy poquitas excepciones. Bueno, Vamos con el que sigue. We would